Has launched a new SHA sponsorship program where 2.2 million vulnerable Kenyans will access medical services free of charge. And as Elizabeth Atieno now reports, the government maintains that the sponsorship program is a step towards attaining universal health coverage regardless of their economic status.
According to the KNBS report of 2022, 20.16 million Kenyans live in overall conditions of poverty. When the Social Health Authority was launched in October 2024, the government highlighted that employed Kenyans will channel 2.75% of their monthly contributions into the Social Health Insurance Fund SHIF, with unemployed and non-salaried Kenyans expected to contribute 2.75% of their household income, with a minimum contribution set at 300 Kenya shillings per month, which is to be in the form of a one-off annual payment translating to 3,600 Kenya shillings. In a bid to assist the vulnerable population, the government has today launched a sponsorship program that will ensure all Kenyans from vulnerable background access medical services for free.
We are paying for 558,000 households. That translates into 2.2 million individuals.
In the new program, the over 2 million Kenyans will have access to inpatient, outpatient, maternity care, emergency, optical, dental, and mental health services without paying a single cent.
Lakini leo ukitoka hapa, unaweza kwenda Akakanda, upige foleni, utakutana na waziri pia anapiga foleni. Utapiga foleni na yeye.
In January this year, the government allocated 950 million Kenya shillings in the 2025-2026 financial year to cover households unable to afford the premiums required for the SHA medical plan. Although the government maintains that SHA is financially stable, there exists a funding gap in the Primary Healthcare Fund and the Emergency Chronic and Critical Illness Fund. Additionally, there are concerns that the number of Kenyans contributing into the health scheme is less than the number of Kenyans seeking services. SHA has collected 70 billion Kenya shillings since its inception, but is grappling with a huge debt owed by health facilities from the defunct NHIF. So far, facilities have submitted claims totaling to over 80 billion Kenya shillings.
We call upon Parliament to incrementally allocate funds to enhance the Primary Healthcare Fund kitty. This will ensure adequacy in financing universal and free primary health care services across the country.
The president has also directed all level 1 to 4 health facilities across the country to offer free services to the 27 million Kenyans who have registered with SHA.
That you can go to any hospital. Sasa tuko na mahospitali 9,000.
In order to identify the poorest households in the country, the State Department for Social Protection will leverage on its existing database, including the Social Registry and the Inua Jamii Cash Transfer Program. Elizabeth Atieno, TV 47, Nairobi.